So I'm performing my halfway health assessment.
How do I know this?
Anyway, so upon going into my patient's room, I will gather my equipment, provide privacy, and perform hand hygiene. So upon entering in, I would notice my patient's general appearance, visualizing if they're clean, if they're wearing clean clothes, if they have any hygiene issues. I can visualize what skin color is available. Notice their skin color. If they're moving around, I will notice their mobility as far as their gait, if they're holding themselves up, and then how well they're able to move, if it's a voluntary movement or if it's involuntary. So upon entering up to my patient, I will ask her to state her name and date of birth.
Elizabeth Evans, 10/26/1988.
Alright, Alyssa, can you tell me what town you're in?
Pleasant Oak, Missouri.
Alright, and the president.
Barack Obama.
Alright, so test your level of consciousness. I'm going to read it 3 times 4. So first I'm going to start with the head and move down to the neck, and then we'll do a cardio and finish the pulmonary assessment. So I notice on her head that her head is symmetrical. There is no visible dents in it. There's no lesions or scars presented. Alright, upon inspection, no dents, no perforated temporal artery. Alright, now I'm going to go and move to her eyes. I'm just going to have you look for shine a light in your eye. I'm going to note whether her pupils are reacting to the light. And I'm going to do it again, but this time I'm going to be checking her left eye as I shine my tan light in her right, or opposite. So I'm going to check the opposite eye. Alright, notice that they constrict to light. Now I'm going to have to follow my pen light. Just move your eyes, do not move your head. I'm just going to test your cranial nerve. Alright, let's just get your eyes focused again.
Thank you.
Welcome. Alright, so upon in a clinical setting, I would have my other scope to assess the inner eye and check her corneas and the back side of her eyes and her nerve endings. So I'm going to move on to her ears. Are you able to hear me alright?
Yes.
No troubles with them?
No.
So I can go ahead and inspect, but I would have my otoscope to further check the tympanic membrane in the inner ear. So next I'm going to do is whisper into your ear. I want you to include your left ear. I'm going to whisper in your right ear 3 words, and I want you to repeat back to me. Okay?
Ball, cat, dog.
Alright, so then I do it on the opposite side, but we're not going to do that.
Okay.
The same with checking her eyes. I'd have her use the Snellen chart, check her visual acuity, and do some other individual tests to test for her peripheral vision. So now I'm going to look at her nose, check if there's any flaring lesions, any drainage. There's nothing there, so we're good. I'm going to have you open your mouth for me. And check the mouth and make sure that it's moist and pink and that there's no lesions. I'm going to look at her teeth, her gums. I'm going to look at the back of her throat, her uvula. Also, I'm going to have her stick out her tongue and say, ah.
No.
Yeah. Alright, so I'm just checking the gag reflex. If the patient was a little bit more unconscious, I would actually stick something to make them gag. So now I'm going to inspect her mandibular jaw. Alright, now I'm going to move down to her neck, assess her lymph nodes. You won't be able to feel them, but if there's something abnormal, you should be able to feel. So now I'm going to have you swallow, and I'm gonna assess your trachea. So she swallowed, I was able to see that her trachea was in the middle. Like it's supposed to be. You can palpate it here. Notice that there's no abnormal bumps. I'm also gonna step ahead here, but since I'm at the neck, I'm gonna listen to your veins, your jugular vein. Now listen to that. Also in the clinical setting, I'd have her lay down and see if I can see her vein pulsating and then measure, make sure that it's at a perfect degree. Alright, so now I'm going to assess the rest of her skin that is visible. So I'm going to notice that it is, her color is consistent with her skin, her ethnicity. I'm also going to assess for the temperature, make sure that it's not abnormally cool or excessively hot. So we're able to tell that it's warm to touch. Alright, inspect her hand. Alright. So now I'm going to listen to your heart. Listen with the diaphragm and the bell. Alright, so I'm going to have you lift up your breast tissue. Just lift it up like with your arm. Like, or you can just lift it up like that. Okay, good. So, listen to your apical pulse count for a minute. While listening, I'll notice if it's a regular rhythm and how strong the beat is, and then if I hear any abnormalities to be able to further assess that. So, also with this, I'm going to have her assess her range of motion with her arms and her hands and fingers. So if you can lift your arms out to the side, hand up above your head. Alright, now to the front, go back in. Alright, and for your wrists, now pick them up. Okay, now for your fingers, can you touch? There you go. Okay. Alright, now I'm going to finish inspecting. Before auscultating, you can assess their appearance of their chest. So I'm going to notice that her chest is flat, that it's not concaving or convexing. Also, I'd be able to palpate, make sure there's no tenderness in her arms or no palpation. Also in the clinical setting, I would have her lie down and then palpate in between her ribs to check for any dullness or any abnormal sounding. But in this situation, I'm not going to have her do that. Now I'm going to listen to your lungs. Take a deep breath. Okay. Next time I press it touches. check in bilaterally to make sure that it's symmetrical on both sides. And then if I hear any abnormalities, to be able to compare it to the opposite side. So now I'm going to listen to her back side, make sure that I do not assess or listen over the scapula, because you won't be able to hear anything. Again, checking bilaterally, and if I was able to hear anything different, then go back and reassess it. Also, with the lung sounds, you can palpate again in between the ribs and hear any dullness and do other further measurements. But do you have any questions for me?
No, ma'am.
Alright, well that's the end. So I probably missed
Oh no.
so many